of you. Welcome one and all. Here we are having the practical training session for Diploma in Pharmacy students of Alwar Pharmacy College. And to start the program, we have among us Professor Dr. V. Gopal sir, who is the principal head of the Department of Pharmacy, the Registrar Academic of Mother Teresa Postgraduate and Research Institute of Health Sciences, a government of Puducherry institution accredited by NAC with A grade. That is in Pondicherry, lies Puducherry. We have Dr. V. Gopal. We know him for a long period of time. He is supporting us with his vast knowledge and experience. He is sharing his views on why the training is required for Diploma in Pharmacy students for their career as well as practice. So we are here having our eminent speaker, Professor V. Gopal, and I would like to welcome Dr. V. Gopal on behalf of the students, the staff, the teachers, and the management of Alwar Pharmacy College, and on my own behalf to this event. This is the inauguration event of the practical training workshop for Diploma in Pharmacy students of Alwar Pharmacy College. Without taking much of his time, I would like to welcome Dr. V. Gopal to share his views on presentation. Sir, please, over to you, sir.
Happy morning to one and all. At the outset, I would like to express my heartfelt gratitude to my very good friend, Professor Dr. Jayabalan. He is a person with a lot of enthusiasm. During this period of Corona, when everybody is restricted to be at home, so being at home, how to improve our knowledge. So this is the venture, he is always into it. And today we are here on the inauguration of the professional training workshop for Diploma in Pharmacy. I congratulate him and his beautiful team. And I wish all the 53 participants who are now into this Zoom meeting a very great day and a very great learning experience ahead. My dear pharmacy students, today I am very, very happy. The reason is today morning at around 8:45, when I was leaving from my home to my college, one person stopped my vehicle. I usually travel in a two-wheeler from my home to the college. So one person stopped my vehicle and then he said, sir, I am very happy today. Then I asked him, very good, very good. The happiness is contagious. So can I know why you are very happy? He said, sir, today I went to buy a tablet in a medical shop. I went with a prescription. I showed him the prescription. The pharmacist took the prescription and then he took the tablet, he put it in a cover, and then he explained to me when I should take the medicine, how I should take the medicine, and then he gave me one balloon. I asked him, what should I do with this balloon? Then he said, you place the balloon like this and you have to blow. Then I said, hey, you are a pharmacist. You are giving me a balloon as if I am a small kid and you are asking me to blow. Then the pharmacist told me, you have to blow 5 times in the morning, 5 times in the afternoon, 5 times in the evening. Then I became very curious. I asked, what is this? Why are you joking with me? Then he said, no. Now, because of Corona, everybody is wearing mask. Everybody is wearing 2 masks. So your lung capacity is slowly coming down because you have 2 masks, your face is tied, you will be not able to breathe properly. So your lung capacity is slowly coming down. So Corona attacks the lungs and it creates great problem to your lung capacity. Now you should improve your lung capacity. How do you improve your lung capacity? For that, there is a very simple exercise, and that exercise is you will have to take a balloon and you will have to blow that balloon 5 times in the morning, 5 times in the afternoon, 5 times in the night or in the evening. So this will improve your lung capacity and your lung functioning. So corona will not trouble you. And as a pharmacist, this balloon is free from my side. So this is what that pharmacist said. And I was so happy. And I asked him, who is your teacher? And he said, Gopal. So I am very happy that one of my students has been today influential in the society, spreading a very good message. And I was still more happy because he gave me one last punch. Sir, you know what your student said? He said, when we celebrate birthday, so how do we celebrate a birthday? We buy a cake, and if the baby is 1 year old, we place one candle, and then we light the candle, and then we ask the child to blow. If the child is 2 years old, we place two candles, we light the candle, and then we ask the child to blow. If it is 5 years old, then we light five candles, we light the candle, and we ask the child to blow. So as the age increases, we increase the number of candles. So as the age increases, the lung capacity should increase. So birthday means it is an estimation of how biologically you have grown. So how do you value your growth? You value your growth by the number of candles, lit candles you are capable of blowing in one go. So in the birthday, we are actually testing vital volume. So the same thing here. So here, instead of blowing a candle, we are blowing a balloon. So this is what your student said. So this was the last punch that made me very happy. So what is there in the life of a teacher? A teacher becomes very happy when he is able to hear that his students are performing extraordinarily well. So today I am very happy as one of my students, a pharmacist, a community pharmacist, is performing extraordinarily well, and his service is being acknowledged by the society. So my dear friends, I'm very happy that 54 DPharm students are here today to start their professional training. Usually we go to a hospital or we go to an industry, and for 3 months we are there in the hospital observing how the pharmacy in a hospital works. Now, because of COVID-19, we are all made to be indoors, but still our thirst for knowledge has made us join for this professional training. The most important part in this training is attitude management. So today in my session, I am going to deal about attitude management. And we will go to the first slide. You are able to listen to me, hear to me, and see my presentation?
Yes, sir.
The slide is not changing. It's stuck.
No problem, sir. Close it and restart it. Yes, sir, it is working.
Yeah. My dear students, तो यहाँ आप एक मैडम को देख रहे हैं. वो मैडम द फर्स्ट फार्मासिस्ट in US FDA. So her name is Frances Kathleen Oldham Kelsey. She is basically a pharmacist and a pharmacologist. So she joined for the first day in her job in US FDA, United States Food Drug Administration. So she was given a file. One pharma company wanted to launch a new medicine in America. This medicine was for pregnant women. So pregnant women in the morning, they have a problem that is called morning sickness. So when they get up in the morning, they feel tired, they have headache, they had nausea. So for that, the company is coming out with a medicine. And whenever any company wanted to launch a medicine in any country, they have to get permission from the Food Drug Administration Department. So they applied to the Food Drug Administration Department. There is one specific application that is called a dossier. And at the time, the Food Drug Administrator was a very noble person, and she received that file and she directed that file to this pharmacist come pharmacologist, Francis Oldham Kelsey. So this lady, she went through that entire file, and then she was not satisfied with the safety profile of the medicine. So she rejected that medicine. That company had already launched this product in many countries. They wanted to launch that product in 41 countries, and America was one among them. In all the other countries, they have got the approval, but in America, they didn't get it. So with all this data, they once again refiled that application, saying that in 41 countries, we are launching this product. In 40 countries, they have already accepted. They have given permission. They have approved. Only in America, it has been rejected. So please consider, and it is for the betterment of the women of America that we want to launch it. Please give us permission. So again, this lady went through the profile, safety profile, and said, see, I am not convinced with the safety of the medicine, so I am rejecting it. She rejected it. The company filed a complaint against her. She was put in trouble. She was suspended. There was a charge that she demanded money. So her finance, her bank accounts were closed. She had a problem with her family also because of this issue. She lost her job. She had met with an accident. In spite of all that, she was very adamant that she is not going to give approval to that product. Somebody else was placed in her position and he wanted to give approval to this product. She went to court. So in spite of so much of difficulties, she was in the court fighting that the product should not be launched in America. So this entire process took 1 year. After 1 year, the President of America, he gave an award to this lady. And that award is called as President's Award for Distinguished Federal Civilian Service. And you can see here, he is John F. Kennedy. So he is the President of America. And on American Independence Day, he gave this award to this lady. Everybody was thinking why the president is giving award to this lady who has been suspended. Then the president himself explained that all over the world, in 40 countries, the mothers who took that medicine delivered babies without limbs, delivered babies without the upper lip. And that drug is called as thalidomide, and the disaster is called as thalidomide disaster. So at the time, they had evidence that 10,000 children, they were born, they were not able to take feed from the mother, they were born with deformities, and they had a painful death. So this number 10,000 is only tip of an iceberg. The actual number is more than 1 lakh. So more than 1 lakh children all over the world died because of one drug called thalidomide, but not even a single child in America died because of thalidomide, because this lady, Frances Oldham Kelsey, stopped this medicine from entering into America. And later she was made in charge of framing the US FDA rules and regulations and guidelines. And that is why the US FDA rules, regulations, and guidelines today are very strict, and they are the best in the world. So my dear friends, one pharmacist has saved the children of America. So that is the greatness of pharmacy. So after this COVID-19, a normal person meeting a doctor is very difficult because doctors are preoccupied. A normal person meeting a nurse is also very difficult because nurses are very busy in COVID care centers. A normal person now has access only to pharmacists. And in spite of lockdown, you can see medical shops open. And all the fellow pharmacists are giving a beautiful service. People suffering from diabetes, people suffering from hypertension, people having day-to-day health problems. Today I'm having fever. Today I'm having sore throat. So will it be corona? So where will they go and ask? They have confidence in a pharmacist. They go to a pharmacist, they ask him, I'm having this. And he asks them a lot of other questions. How far you are having this fever? Are you able to smell? Are you able to get the taste of what you are eating? And do you have body pain? Then he directs them to the COVID testing center. So once the test is positive, then he directs them to take a CT scan, and then he directs them. So this guidance is given by a pharmacist. And today we are being recognized by the society. And this recognition is because of two things. One is knowledge and another one is skill. So knowledge and skill is very, 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 very important in this world. My dear friends, 40 years back, a person who had lot of land was considered rich. 30 years back, a person who had gold and silver was considered rich. 20 years back, a person who had followers, who had muscle power was considered rich. Today, who is the richest man? Today, the richest man is Bill Gates. Bill Gates is not having land. Bill Gates is not having gold and diamond ornaments. Bill Gates is not running any political party or is not having any muscle power people with him. Bill Gates is having knowledge. So this is a knowledge era. If you have knowledge, you will come up. Today, the most successful person who is there on the media daily is the person who makes COVID vaccine, Covaxin, Covishield vaccine. The person who makes it is very great because he is saving the lives of people. So, my dear friends, today knowledge is power and you should improve your power. My dear friends, you may be thinking that you are a diploma holder, and this Frances Olde Kelsey, she is, I think, doctorate in pharmacy, pharmacology. So as a diploma holder, what can I do? So my dear friends, here I am showing you the photograph of Mr. Chilikuri Paramatma, who is from Andhra Pradesh in Nalgonda district, who is running a medical shop by name Vijaya Pharmacy, and he is a diploma in pharmacy holder. But this diploma in pharmacy holder, Chilikuri Paramatma, has made the whole world look at him. So what did he do? So he came across an incident where a couple who after 4 years of marriage did not have children. They went to the doctor and they underwent treatment. And then after 4 years of marriage, that lady, she became pregnant. So when she was in the 8th month of pregnancy, she went to the gynecologist for testing. The gynecologist prescribed a medicine called Terental. Terental is for improving the circulation in the womb. But when they came to the medical shop, the actual pharmacist was not there. Instead of the registered pharmacist, some other person was there. Instead of Terental, he gave one medicine called Tegretol. So Tegretol is an abortifacient agent. And because of that, that lady underwent abortion and lost the baby. So Chilukuri Paramatma learned about this incident. See, tegrital, parental, both are nearly having the same spelling. So they are sound alike drugs. They sound alike. So instead of giving one medicine, he has given the other medicine, and they have lost their baby, a baby which they have got after 4 years of marriage. So he sat in his pharmacy and then he took a list of drugs which are look alike and sound alike. So he came across 100 pairs of drugs which have similar sound, tegrital, parental. Like for example, buscofan and busufan. Buscofan is for stomach pain. Busufan is for cancer. Hyphen is for ear, nose, and throat infection. Hypen, Hypen, is for systemic infection. So like that, he came across 100 drugs with names of similar sound. He wrote it, and then he went to the Director of Health and Family Welfare Services in Andhra Pradesh. He gave it to them, and then he said, "Sir, ये ड्रग्स का नाम एक जैसे ही है." अभी ये डॉक्टर ने उनको हैंड राइटिंग इतना अच्छा हम पढ़ नहीं सकता है, रनिंग में लिखता है, तो एक दवाई की सिवा दूसरा दवाई दे दिया तो ऐसे प्रॉब्लम हो जाता है. तो आपने डॉक्टर्स को एक रूल दीजिए कि डॉक्टर्स शुड राइट द प्रिस्क्रिप्शन ओनली इन कैपिटल लेटर्स. So the Director of Health and Family Welfare Services asked him, "Who are you?" So he said, "I am a community pharmacist. This is my identification." So as a pharmacist, how can you say this to a doctor? Then he said the story. "Sir, this is a story. So, and this is truth. So to save the people, I am saying this." So the director said, "Okay, we will see." Nothing happened. Then he went to the health secretary. Nothing happened. Then he went to the health minister. Nothing happened. He went to the chief minister. Nothing happened. He went to the union minister of health. Nothing happened. Then he went to court. So as a community pharmacist, he went to court, and the court directed the government and the Indian Medical Association to give strict rule that all pharmacists henceforth should write the prescription in capital letters. And this landmark judgment was possible only because of the single person, Chilukuri Paramatma. He is a pharmacist. He is the proprietor of Vijaya Pharmacy in Nalgonda district in Andhra Pradesh. So one pharmacist has made the world look at him. So if you have willpower, if you have attitude, if you have the knowledge and the skill, and if you have the willingness to serve people, then you can reach great heights. So my dear friends, आज आप देख रहे हैं प्रोफेसर महादेव लाल श्राफ. He is the a father of pharmacy education in India. He is the person who introduced bachelor and master's course in the discipline of pharmaceutical sciences in India. He is the first editor of Indian Journal of Pharmacy. He was the first vice president of Pharmacy Council of India. He formed the Indian Pharmaceutical Congress Association, and he was part of many government policies. My dear friends, today, if you look, the difference in salary between a pharmacist and a nurse. If you take ANM, auxiliary nurse and midwife, and if you take DPharm, the difference in salary between a auxiliary nurse and a community pharmacist, you can find there is a very good difference. Nurse salary is high, pharmacy salary is low. If you take a degree pharmacist, DPharm pharmacist, BSc nursing staff nurse, the difference in salary, again, the salary of nurse is high. Throughout, that profession is nourished. Why? Because the society is able to appreciate the greatness of that profession. With that national health policy, the word pharmacy was left out in the last policy. Then we have to fight and we have to get it entered. In the health department, Union Ministry of Health, there is advisor for nursing, but there is no advisor for pharmacy. So the community is able to understand the service rendered by nurse. But today, the community is not able to appreciate the service rendered by a pharmacist, because in many shops in the community, a non-pharmacy person is dispensing. If a pharmacy person is dispensing, he will first give counseling and then he will dispense. But if a non-pharmacy person is dispensing, he will just give the medicine and take the money. So he will be just like a salesperson. There is one place called New Jalpaiguri. In New Jalpaiguri, there is one government pharmacy. In that government pharmacy, the chief pharmacist came to Professor Mahadev Lal Shroff. We call him as M.L. Shroff, the father of pharmacy. And then he said, "Sir, हमारा hospital में कोई हमको importance नहीं दे रहा है, कोई हमको honor नहीं दे रहा है, हम भी काम कर रहे हैं, लेकिन हमको कोई देखने वाला भी नहीं है." तो श्रॉफ साहब ने उनको बोला, आप एक काम करो, आज सोमवार है, आज सुबह 10 बजे आपका फार्मेसी में कितने लोग हैं? तो उन्होंने बोला, हम 6-7 लोग हैं। तो आप 7 लोग निकलो, सबके साथ एक प्लैकार्ड पकड़ो, उसमें लिख दो, फार्मासिस्ट is the maker and messenger of medicine. Pharmacist is an authority of medicine. Ask your pharmacist regarding all clarifications, doubts, and inquiries regarding medications. Store your drugs properly. Keep the drugs out of reach of children. I say placards, card में ऐसे लिख दो, ऐसे हाथ में पकड़ दो, और न्यू जलपाईगुड़ी की बाजार की स्ट्रीट में एक what do you call, you go on a procession, जाओ, 7 लोग साथ में जाओ. So all the 7 people, they went on a procession on New Jalpaiguri Bazaar Street, morning 11 o'clock sharp. So everybody was looking, ये लोग क्या है, ये क्यों इधर आया है, like that. First day silent rally, सब लोग एप्रन पहना और उसमें फार्मासिस्ट का नेम बैज था, हाथ में एक प्लैकार्ड था, वो एक पोजीशन में जा रहा था. तो मंडे में हो गया, ट्यूसडे 11 o'clock हुआ है. तो लोग सोच रहे थे, ओह ये तो फार्मासिस्ट है, या हॉस्पिटल में हमको लिए सेवा करता है, तो ये दवाई देता है. थर्ड डे उनको पानी दे रहा था, उनको ग्रीटिंग कर रहा था. फोर्थ डे उनके साथ वो भी चलने लगे. तो पहले 7 लोग थे, अभी 70 लोग बन गए. फिफ्थ डे उनके लिए इंतजार करता था, अभी 11 बज गई, वो कहाँ नहीं आया. जब वो आया, उनको माला लगवाया, तालियां बजाया, वी आर रिकॉग्नाइजिंग योर सर्विस टू आवर सोसाइटी. तो 7 days उन्होंने एक पोजीशन लिया, और 7th डे में लोगों को पता चला कि हॉस्पिटल में ये फार्मासिस्ट लोग है, वो उनका काम बहुत आसान है, बहुत अच्छा है, उनकी सिवा हम सुरक्षित नहीं रख सकते, नहीं रह सकते. So the people were able to recognize the greatness of the profession of pharmacy by taking 7 days continuous possession on the bazaar street. And that is why we celebrate this as National Pharmacy Week. And this took place in the 3rd week of November, I think. And that is why we celebrate it as National Pharmacy Week. So my dear friends, today we serve a lot. I said, no, one of my students today has given balloon, free balloon. Balloon is only 1 rupee. But giving balloon and explaining it and giving it, no, that doesn't have, you cannot put value. It is highly valuable. So now this is not noticed. It is not available in any media. It is not available in newspaper. It is not available in television. So now to improve the visibility of our profession, we have to bring all this to limelight. अभी जो भी हम काम करेंगे, वो लोगों को बताना है कि फार्मेसी लोग इतना कर सकता है, फिर the profession of pharmacy will improve. So this is a beautiful message given by Professor Mahadev Lal Shroff, the father of pharmacy education. So whatever good things you do, you see that it comes out in the media. Then only it will reach the people and our profession will come into limelight and people will be benefited. My dear friends, right from the school, you have been learning about Newton's law. For every action, there is an equal and opposite reaction. So when an apple falls from a tree, you think about Isaac Newton. How many of you know that Sir Isaac Newton started his life as a pharmacist? So my dear friends, showing you the photograph of Isaac Newton. He served as an apprentice in the apothecary shop. Apothecary means medical shop in Woolsthorpe. Woolsthorpe is the place where the apothecary shop was there. So he served as a pharmacist. He lived in that shop and he got married to that medical shop owner's daughter. So you can see how pharmacy is there even in the life of Sir Isaac Newton. So next time when somebody is asking, you can say, Sir Isaac Newton is a pharmacist. Because of his interest in pharmacy, he was able to come out with his laws, Newton's laws, law 1, law 2, law 3. Okay. You might have heard about a number of proverbs. An apple a day keeps the doctor and the dentist away. So this proverb was given by Benjamin Franklin. So he has given two beautiful proverbs. One is, an ounce of prevention is worth a pound of cure. And another one is, an apple a day keeps the doctor away. This everybody knows. So my dear friends, today it is a period of COVID-19. So in this COVID-19, we need to protect ourselves. So today you go back home and then you say, today we had a beautiful workshop and we have got a lot of information. So from tomorrow onwards, all our family members will have to expose ourselves to sunlight, minimum 15 minutes, 7:30 to 7:45 in the morning, we will expose ourselves to sunlight. Why? To get vitamin D. So vitamin D will improve our immunity. So with this improved immunity, we can face COVID-19. Today you say to your family members, today we are going to take a capsule of vitamin C and vitamin zinc. Why? To improve our immunity. There are a lot of citrus fruits. You have to take 3 oranges. You have to take 2 mangoes to get the daily dose of vitamin C. So vitamin C will boost your immunity. And whenever, you all know, we wear masks, we make use of hand sanitizer, we maintain social distancing, but number of hand sanitizers that are available in the market, they are not of good quality. So because of that, many people are having skin irritation, dry skin, and other problems. My dear friends, as a pharmacist, you know, coconut oil can kill the COVID-19 virus. You go through the net, you go through the books available in your library. Coconut oil will kill bacteria, it will kill fungus, it will kill virus. So if you can apply coconut oil on your hands, even that can protect you from this virus. And the coconut oil is very, 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 very safe. So when you are at home, when you are touching different surfaces, why don't you apply some coconut oil? So coconut oil is very safe. And see, you can fumigate your home with benzoin. So benzoin, you know, in pharmacognosy, you have studied about benzoin. So benzoin, when you fumigate your home, it kills the COVID-19 virus. So like this, there are a lot of health tips that are available in pharmacy, in pharmacognosy. So you can take it and you can give it to the people so that people will appreciate you. So you see, knowledge is power. So with this power, you will have to show to the world that you are powerful. My dear friends, I'm introducing you to one more pharmacist. His name is called Sertuner. So he was a person who discovered morphine. So today, number of cancer patients who are not able to bear the pain, they are relieved from pain because of morphine. And this morphine was discovered by a pharmacist. Now, this morphine is misused. So when you misuse this morphine, what happens? then it becomes addiction. So there was one pharmacist. This pharmacist is called as John Pemberton, and this John Pemberton was an American pharmacist. He became addicted to morphine. So to overcome his own morphine addiction, he discovered a stimulant. That stimulant is called as Coca-Cola. So today we are all addicted to Coca-Cola. This Coca-Cola formula was given by a pharmacist by name John Pemberton. Okay, so he created Coca-Cola, the most popular drink, and he himself was addicted to morphine. He was able to overcome that addiction by taking Coca-Cola. So you can see we are going to now see the next pharmacist. His name is Jesse Booth. So during the period of Jesse Booth, that is in the 18th century, medicine was very costly. So the poor people were not able to buy the modern medicine. So Booth was the first person who came out with a phenomenon called health for a shilling. Shilling is around 1 rupee value. So he said, just for 1 rupee, I will give you health. And he started the first Booth's pharmacy in Nottingham, where the medicine was very, very cheap, but of very good quality. And that is how Booths have become very popular all over the world. You all know about Alexander Fleming, who discovered penicillin. So, great contributor to pharmacy. And here I am showing you the 38th Vice President of America. His name is Humphrey Jr. He is a pharmacist. And I am showing here the inventor of Pepsi. So Coca-Cola and Pepsi, they both are competitors to one another. And here you can see the inventor of Pepsi. He is Caleb Davis Bradham. So he is the inventor of Pepsi. And here you can see the 39th governor of United States of Illinois. So he is again a pharmacist. And here you are able to see a Brazilian writer, activist, orator, and a pharmacist who worked for the abolition of slavery. He is Jose Carlos. He is again a pharmacist. The person who invented the Dragon Drop reagent, he is a pharmacist. And Kerry Hoare, she is an Australian world champion, Olympic champion. So she is a pharmacist. And we all know about an Australian politician called Annie Catherine. So she is a pharmacist. And this person is Mr. Sugavanam. He defeated the former Dr. Jayalalitha in Tamil Nadu in 1996 state election assembly, and he is a pharmacist. So he is Girish Kasaravalli. So he has got Padma Shri, National Film Award, Best Feature Film. He is a Kannada cinema artist, and he is a pharmacist. And I am showing here a beautiful pharmacist by name Colin Murdoch. So this Colin Murdoch, he is a multi-talented pharmacist. So he has 46 inventions. See, today we are all taking this COVID vaccine, Covaxin, Covishield vaccine. So that vaccine is through a disposable, sterile, hypodermic syringe. So he, at the age of 27, he as a pharmacist, he invented the first disposable, sterile, pre-filled hypodermic syringe. Then in 1956, there in New Zealand. So such a great invention, number one. Number two, he invented veterinary tranquilizers. Today, inside the town, sometimes you can see tigers enter, leopard enter, fox enter, sometimes elephant go mad. So to control them, we make use of veterinary tranquilizer. So that was invented again by this Colin Albert Murdoch, a pharmacist. So burglar alarm. Today in every house we have a burglar alarm. So fire alarm, both he only invented. Child-proof medicine bottle cap. Today, if you see the medicine bottle cap, it's very difficult to open. A child cannot open, only an adult can open. So that was designed by this Colin Albert Murdoch, again a pharmacist. So I'm showing you another great pharmacist. His name is Ignacy. So this Ignacy, he is also a great person. He is in Vienna and he is a master on pharmacy, and he has a number of discoveries to his credit. He discovered the rich deposits of crude oil in his place, and he promoted constructions of schools and hospitals. He's a great personality in his place, and he is a pharmacist. So there is one more pharmacist called John Walker. So this John Walker, he is a great pharmacist who has done a lot of things to the society, and he was a orator, he was an actor, and he was in London, and he was a great person who the world is able to appreciate as a pharmacist. So this person has also has a credit of discovering matchbox. So today the matchbox that we all use for lighting was discovered by this great personality, John Walker, again a pharmacist. So we have seen about the world great pharmacist. Now, why India is now developing as the pharmacy of the world? So that we are going to see. Number one, in India, the medicine is low cost. That means it is very cheap and it is of high quality. So because it is cheap, it is affordable to all the people. So in the whole world, only in India, you will get medicine at a very low cost and at a very good quality. 1 million people around the world rely on India for affordable medicines. So today we have engineering skills, we have reverse engineering skills, where life-saving drugs we are able to make in India at a very cheap cost. To take, for example, imatinib. This is an anti-cancer drug. So that is made in India at a very cheap rate. Zidovudin, that is also made in India at a very cheap rate compared to the other countries. So like this, the cost reduction in India is more than 99%. See, I can give you here one strategy where you can see access to affordable AIDS treatment from India is one of the greatest success stories in medicine. 80% of developing countries antiretrovirals or generics produced in India. So can you imagine 80% of antiretrovirals, ARV drugs are from India. So that is the greatness of India. So I am going to now introduce you to a great pharmacist. His name is Dr. Yusuf Hamid. So he is the owner of Cipla company. In the year 1999, WHO announced that AIDS is the #1 killer in Africa. So big pharma companies, they have come out with medicine for AIDS, but they took patent and they were monopoly. That means they were charging around $10,000 US per patient per year for antiretroviral medicine. People cannot afford $10,000 US per year, but the same drug, same quality, Dr. Yusuf Hamid of Cipla produced it at $1 a day. 10,000 to $1. That means 99.99% price cut. And thereby, India is now the world's primary source of affordable HIV medicine, as it is one of the few countries with the capacity to quickly produce new HIV drugs and generics. So the whole world, they have major donors like Global Fund, United States President's Emergency Plan for AIDS Relief. So all these great people, they buy anti-AIDS medicine from India. Even if you take Corona, we have been donating this vaccine, COVID-19 vaccine, to the whole world for free. And we are the leading producers in Covaxin and Covishield. So India is one of the biggest suppliers of low-cost vaccine in the world. The vaccines produced in India are used domestically and also exported to nearly 150 countries. The recombinant hepatitis B vaccine is an excellent example of India's low-cost medicine. Large multinational pharma companies, they had monopoly on this hepatitis B vaccine, and the price was very high, $23 per dose. And India brought it to $1 per dose. And today, for UNICEF, the only supplier for hepatitis B vaccine is India. India prevents evergreening and makes affordable generics possible. That means a pharma company will discover a new drug. It will take patent. The patent will be there for 8 years. After 8 years, they will take patent for the same medicine for some other use. And again for 8 years, the patent will go. So that is called as evergreening. That evergreening is not there in India. So we have a very strict medicine patent law, and that is why medicine is available to the normal person. Today, after this COVID-19, everybody is speaking about this imatinib. So the law has a patent decision in 2005 that rejected the Swiss pharmaceutical company Novartis attempt to patent the salt form of imatinib, a life-saving medicine for treating chronic myeloid leukemia. Now, this imatinib mesylate is produced in India at the cost of $790 per patient per year, whereas in America it is $1,06,322 per patient per year in America. So you can see the rate difference, and we are able to give it at such a low cost and such a good quality. It is because of the laws that govern medicine in India. There is a sky-high price of patented drugs in America and low-cost Indian generics. If you go to any town today, you can see one medical shop that is called Pradhan Mantri Jan Aushadha Kendra. So in this Pradhan Mantri Jan Aushadha Kendra, quality medicine is available at a very, very cheap cost. So I can give you some information here in this tabular column. So if you take for AIDS, 3 popular medicines are used. One is tenofovir, and another one is emtricitabine, and then efavirenz. So for all this patented medicine, the cost per person per month is 2,500, whereas in India it is $12. Hepatitis C. Here, the patented medicine is 49,000, whereas the generic medicine is 151. Similarly, you can see for all these diseases, for all this medicine, the patented medicine is very costly, whereas the generic medicine is very cheap. So we have become the pharmacy to the world. My dear friends, before I close, I think 1 hour is coming to an end. I would like to share one of my experience. Just before the second wave of COVID, at the end of the first wave of COVID, my students were doing hospital training in government hospital. So I went in line just to see how my students are counseling and dispensing. I was in a normal dress. I was standing in the queue and as a patient to take medicine from the pharmacy. So two ladies were standing in front of me, and one lady was saying, "ये गवर्नमेंट हॉस्पिटल में क्या दवाई देता है, कुछ काम नहीं करता है." तो दूसरा लड़की की बोल रही कि नहीं नहीं वो अच्छा काम करता है, मेरे को भी फीवर हो गया था तो मैंने कैप्सूल दिया, मैंने लिया, मेरे को फीवर चले गया. तो द फर्स्ट लेडी वाज सेइंग नो नो, मेरे को भी फीवर हो गई, मैंने भी दवाई लिया, यही कैप्सूल लिया, लेकिन मेरे को ठीक नहीं हुआ. तो तारा दिखा कैप्सूल दिखाओ, तो दे शोड द कैप्सूल, बोथ द कैप्सूल्स वर सेम. अरे तेरे को काम कर रही है, मेरे को काम नहीं कर रही. तो दूसरा लेडी बोल आपने तूने कैसे लिया, तो ये कैप्सूल को ऐसे मुंह में लेकर पानी डाला और एंगल्प इट. तो ऐसे नहीं करने का. देखो ये कैप्सूल में दो कलर है, ऊपर वो देख रहे हैं ना वो रेड है, नीचे जो देख रहे हैं ना वो ब्लू है. वो रेड हमेशा अंदर जाने जैसे वो दवा को खाने का. ऐसे एक लेडी दूसरा लेडी को बोला, तो वो ऐसे है क्या, मैंने ऐसे खा लिया तो इसलिए उसको इफेक्ट नहीं है. So in India, we have people who create beautiful stories. A capsule will have a crown and a body. You take it in whichever direction, it is going to give you effect. But people are so cautious that they take the tablet such that the crown goes in. So this is the heights of ignorance. My dear friends, you go to any house, you can see tablets on the wash basin shelf. You can see tablets on the fridge top. You can see tablets. Some people place the tablets on the stabilizer on the fridge where there is heat generated. People, they take tablet, they keep it on the shirt pocket and then they go in the sun. The capsule will melt. Some people, they take tablet without drinking water. When they are traveling, they take a tablet, they put it in water, they just engulf it. So, my dear friends, there is a method how to take the medicine, and that method has to be counseled by the pharmacist to the patient. So, if we do this duty, then we will be acknowledged by the community. Once the community acknowledges, then our profession will grow. Once the profession grows, then we will grow. So, my dear friends, knowledge is important. So, daily learn about medicine. You should know, when you give a tetracycline, you should say to the patient, see, don't take it with milk. When you give an iron tablet, you should say to the patient, don't take it with milk. That fellow will say, why? Why should they not take it with milk? You should say, so the absorption of iron is interfered by milk. So that is why I'm saying don't take it with milk. So like this, you should give counseling and then you should dispense. If you counsel and dispense, then the recognition for our profession will improve and you will be recognized. You will be satisfied that you have done your duty as a professional pharmacist. So this attitude you will have to develop. I once again thank the organizers for this wonderful opportunity, and I wish all the students to develop this attitude of being a good pharmacist. I wish you a great day ahead. Thank you, one and all.
Thank you very much, sir. Sir, it is a nice presentation with enormous details to the pharmacist to feel themselves great, and there are a many number of pharmacists who have achieved something in their life. So this and all happens with the knowledge, skill, and attitude. This KSA set is utmost requirement for every pharmacist, and this is the basic thing that we have to possess in your career so that we can grow in our career like anything. So this was very well explained by Professor Dr. V. Gopal, and that is our great speaker today. Sir, thank you. We are all very much overwhelmed with your presentation and your talk. You have started our practical training workshop from today, and it will go for 7 different speakers and different topics like different attitudes, different skills required for pharmacists, and managerial skills, and computer skills. What are the other requirements for running a pharmacy business? Even now, we are seeing some of our students who are standing behind the racks, and they are in the pharmacy right now.
Oh,
We are able to see them also. If Preetham unmute his camera, we can see the medicine racks in behind Preetham. So there are so many pharmacists right now are working in the service to the people who are suffering with diseases like COVID. And I thank you very much for your time, your energy, and your knowledge that is shared in this platform for our students. You didn't take it lightly because you are dealing with all level of pharmacy students like diploma, degree, PG, PhD. You didn't take it light. This is for diploma students, and we need not go in deep. So you have taken so much of pain that we are seeing in your slides, and we respect your pain and we respect your time that you have spared for us. Thank you very much, sir. And this is from our heart. On behalf of all my students, all my staff, all my teachers, and the management of Allur Pharmacy College, I thank you very much for the wonderful presentation, sir. Thank you very much, and hope we will meet in another occasion very soon in Allur Pharmacy College online series. Thank you very much, sir. Thank you, and I thank you all, my dear students. And tomorrow there will be another session by 11 a.m. and I'll send the link very soon to you. Please wait for the link. And Preetham is on with his camera now. You can see the racks in behind Preetham also. He is our pharmacist on duty now.
very nice. Very happy to see you.
So, thank you. Thank you very much, sir.
I will take it. Thank you.
Thank you. Thank you very much, sir. Thank you, all of you. And with all the permissions, I would like to end up the